a warm applause, Dr. Janet from Nepal. Dr. Janet, can you hear us and see us? There's a small technical problem. Are we able to solve it, or shall we proceed with the second panelist? I need some advice. Dr. Janet, can you lift your hand if you can hear us? Okay, so okay, we cannot hear you, but you can hear us seemingly. Okay, we cannot do lip reading, so we give us just a minute so that we solve that problem. I switch off my mic. Maybe this is preventing her to participate. Can you please speak again?
I can hear you. I don't know if you hear me, but I can hear you.
We can hear you.
So I can hear me. Okay, they say I should proceed with the presentation. If you can hear me, I'm going to then have to share my screen because it seems like, are you going to share the slides for me, Richard? Or must I? Okay.
You can share the slides.
Okay, so let me do this. Are you able to see the slides now? Can you see the slides, please?
Yes, we can.
Okay, if you can see the slides, I'm going to proceed. I can hear you say yes. So let me proceed. So just like the moderator kindly presented me, my name is Janet Biaruhanga. I'm a Senior Program Officer for Healthcare at the African Union Development Agency, NEPAD. And as the moderator rightly said, we are a continental intergovernmental organization, an organ implementing the African Union's priority and flagship programs. In particular today, I would like to share with you what we are doing in regard to pharmaceutical manufacturing on the continent. Way back in the year 2005, the African Union heads of states and governments collectively agreed to respond to the then three pandemics, HIV, TB, and malaria, to make sure that the continent was able to sustain people who were taking medication of those three pandemics sustainably on those medications, and that they were of good quality and they were made accessible and available and affordable to those people who needed them. And at the time, there were certain rounds of Doha discussions around taking advantage of the flexibilities within the treaty. And that is when the whole conversation of having a continent-wide program that strengthens the capacities and capability of the continent to produce its own medical products started. Then in 2007, the African Union Commission, working with the various stakeholders, developed the pharmaceutical manufacturing plan for Africa, which I'm going to be presenting to you, which gives you really a continent-wide view of what areas we're trying to address in order to strengthen our capability to produce medical products on the continent. So as you can see, this little house here, it shows you the ultimate goal of our endeavors on the continent to produce medicines in Africa. Ultimate goal is public health related, and it's to do with ensuring that the medicines that are produced locally will be of good quality, they will be made accessible to the people who need them and available, and there will be industrialization aspects and economic development aspects. We are looking at using the available opportunities and harnessing the competitive nature of our continent, comparative advantage of our continent, to make sure that our industry becomes viable, becomes competitive, and produces medicines at a sustainable level and is self-reliant. Just as we have learned from the COVID pandemic recently, we saw that the supply chains were all broken down, and the impact of not having a self-reliant industry was made visible to all of us. And now we are all about strengthening local capacities. And this is a good conversation, and it was a good wake-up call. However, in order to achieve those two ultimate goals from the industry perspective and from the public health perspective, we are encouraged as governments and collectively, or at a regional level or at national level, to have this political commitment that is not only a political statement, but rather a commitment that translates into policy, and policy that is coherent across the various sectors in order to enable this industry to grow. Thirdly, we would require a sound sector strategy for those countries that are intending to enter this business. We don't encourage all countries to manufacture medicines because that is not a viable pathway. You have had many talk about regional hubs being created or evolving into being regional hubs. That is the idea that we're pushing for. However, the countries that will need to engage in this need to have a sound sector-specific strategy that defines the how, the where, and ensures that the goals that are set are met. What are the challenges that at a continental level we seek to address? These are challenges that are normally confronting the industry itself, the SMEs that are trying to, be viable in this competitive world of manufacturing medicine have got an issue of having human resources and skills that are not up to scratch. And so we need to address the numbers and the quality of skills that we have for such a highly skilled industry. Number two are the challenges related to access to product and technology, and then access to affordable, more predictable financing systems, as well as limited incentives. We know that governments do not have so much role as in the actual manufacturing of medical products. However, they would definitely provide the necessary incentives to allow the industry to grow. We have talked so much in the past few days and during this conversation this morning, we have had the importance of having regulatory systems that are strong and that can be enforced and that are harmonized. So that is an area where the African Union Development Agency, NEPAD, has focused our efforts to harmonize, to ensure enforcement of regulatory requirements across the continent. Building of the relevant partnerships and fostering business linkages is another area we think needs to be addressed and needs to be harnessed, and the strategic partnerships that we create, we hope can create a win-win situation where the continent not only creates a robust ecosystem, but also is self-reliant in terms of what it gets from these partnerships and what the partners that are coming in from the outside of the continent are also getting, so that we do not seem to have a biased relationship with these partners. Lastly, we have challenges regarding markets, and I know somebody this morning had already alluded to the situation of if we do not have adequate markets, we will not be able to become a viable domestic industry when it comes to pharmaceuticals, because here we are competing with India and China and others that have got already over time the economies of scale built sufficiently for them to lower prices, make products more affordable, and also access the donor markets where pricing is one of the key determinants of whether you get the tender or not. So it's important for us to get information around what is the market data system that is available and what type of information do we have on the African pharmaceutical and medical product markets. How fragmented are they? What are we doing to reduce that fragmentation in all its aspects? So those are the key areas that we focus on. Currently, the key continental initiatives that are currently ongoing, and you may already have heard about them, is the African Medicines Regulatory Harmonization Initiative, which has created a foundation for the establishment of the African Medicines Agency, an agency that will soon start its operations in Kigali, in Rwanda. This will be the institution that is going to complement the national regulatory authorities with capacity, with the harmonization, continued work of harmonizing their regulatory requirements and strengthening really the entire value chain for regulatory operations. Then the ACFTA anchored local pharmaceuticals production initiative is one that one of the WHO representatives this morning spoke about. That's about supporting procurement from local manufacturers within the small island countries. This we have been working with the UNECA as well to support the small countries in the Horn of Africa, particularly to be able to procure at an affordable cost through this kind of pool procurement from local manufacturers. Then we have the bigger procurement supply chain platform that the medical supply platform that was created thanks to Strive CU and his team and the Africa CDC and other entities like UNCA and the bank, Afro-Exim Bank, and so on, who supported in the establishment of this platform where PPEs were being procured for response to the COVID. This platform definitely we envisage expanding this to definitely cover more of the product in terms of the range, the scope, and also the engagement of local manufacturers in harnessing this kind of platform. We also have initiatives from our pharmaceutical conference of 2019 that seek to do a best practices framework. We also have the learning management system that enhances capacities in terms of institutional capacity and human resource capacity development. It's an online platform that we use to support projects. Then from a access to finance perspective, we are in discussions and continue to engage the FDIs, I mean the banks and the financial institutions within the continent to support and host the Fund for African Development that will be granting or preparing, supporting SMEs to access cheaper funding for their work in local manufacturing. Then you have heard of the Partnership for Africa Vaccine Manufacturing, where a few countries in the continent post-COVID have been talking about enhancing their capacity to be able to produce vaccines. And this has triggered a lot of work in terms of quickly achieving maturity level 3 and 4 in 4 countries that will be engaging in this vaccine manufacturing. Then we have at the AUDA, the Homegrown Solutions Accelerator that seeks to support the small businesses within the continent who are engaging in a better sense of their project and to make them access funding, access markets, and negotiate better project development and then deliver their homegrown solutions more effectively and efficiently. This is my current engagement right now. In the next few weeks, we are going to be adopting a governance framework that helps us to effectively coordinate the implementation of the Pharmaceutical Manufacturing Plan for Africa initiatives, which have become very complex on the continent, because every country is talking about some initiative or another to enhance their local production capacity. So we realize there is a critical need for effective coordination of these initiatives. And via this governance framework, we will be able to know who is doing what where on this continent so that we can use the minimum resources that are available on the continent more effectively and efficiently. And my other headache right now is the consolidating content for a compendium of good pharmaceutical policies and practices. These will also enable the countries that are engaging in promoting domestic pharmaceutical production to know what kind of policies and what kind of practices are good for such an industry, and then using definitely just review what is currently happening within the continent and in other continents to see what is best practice, and then sell it out to our member states. This is finally what the PMPA governance framework that we're proposing will kind of look like. So we'll have an advisory board, a steering committee, a secretariat, a partnership platform where all the partners that are supporting different thematic areas along the challenging areas that I spoke about will come in to support our work, and we'll be using this mechanism to understand what's going on in the continent when it comes to GMP, which is good manufacturing practice, when it comes to trade policy and incentives, when it comes to access to finance, data systems and market intelligence, supply chain management, of which most of you are talking about this morning. And therefore, at a continental level, we need to understand who's doing what where in which member states and how can we harness